COPD Awareness Month, a time dedicated to the millions living with COPD. Hartford Healthcare and Wellinks have been pioneering an innovative care model to help people living with the chronic obstructive pulmonary disease to improve their health. Joining us today to tell us more is Geoff Matous, the President and Chief Commercial Officer of Wellinks. Welcome.
Thanks so much. It's a pleasure to be here and talk to you a little about Wellinks and COPD Awareness Month and the great work at Hartford Healthcare.
Great to have you here. So before we get to COPD, we're bombarded by these commercials about what drug companies can do to treat it. Tell us what COPD actually is.
You know, unfortunately, 25 million Americans know COPD is the reason that they're living with shortness of breath. So COPD is chronic obstructive pulmonary disease. Like I said, it affects about 25 million people living in the U.S., and about half of them aren't even diagnosed yet. It's a combination of several conditions. You often hear about emphysema, chronic bronchitis, and some others. It's the third leading cause of death by disease and the fifth most costly chronic condition. And importantly, it's not curable, but it's very much treatable and manageable. Like you referenced the pharmaceutical companies, there's medical and non-medical ways like lifestyle management and behavior change that patients can pull into their lives to improve quality of life and live well with COPD.
All right, Geoff, tell us, what is Wellinks?
So Wellinks is a Connecticut-based leader in virtual first care for COPD. As you know, more people are now able to receive care from the comfort and convenience of their home for chronic conditions that have a large burden on the lifestyle of people living with them. That's a huge game changer. So what we do is we help people living with COPD to access that care that exists between doctor's visits. So things like pulmonary rehabilitation, exercise programming, long-term goal setting, clinical health coaching, where we connect with respiratory therapists on a one-to-one basis and help patients have support when they need it from that comfort of their home. And then we tie it all together with a phone app and some connected devices so we can help people monitor their health and manage their condition, again, from the convenience of their home, between doctor visits, and to be part of the overall healthcare ecosystem, that care experience.
Okay. Tell us about the research study Hartford Healthcare and Wellinks have partnered on.
Well, you know, the team at Hartford Healthcare has an incredible pulmonary program. And amongst other things, they also have a research institute. And we've started this program called POWER. It's an IRB-approved study looking at patients who have left the hospital after a COPD-related hospitalization. And they enter into the Wellinks program to help with that post-acute, what we call the post-acute discharge period. So we're helping them transition to the home, get back to a higher quality of life, and wrapping around them with the kind of support that Wellinks gives to our members. And then making sure that we're able to connect back to all of those great healthcare assets that Hartford Healthcare has in the community.
All right, Geoff Matous, President and Commercial Officer with Wellinks, thank you for joining us and bringing up to speed on your program.